Doctors and pharmacists are urging Albertans to get vaccinated as flu cases surge. Experts warn low vaccination rates could lead to more severe illnesses and put pressure on hospitals this winter. Mark Villani has more from healthcare professionals and how the province is responding.
With family gatherings around the table and Christmas parties in full swing, it's known as the most wonderful time of the year, but not for everyone.
This is the worst part of the year for pediatrics. We see a huge influx of pediatric patients coming into our hospital.
Alberta's positivity rate for influenza is up more than 5 times in just the last month, accounting for more than 2,000 lab-confirmed cases, 519 hospitalizations, including 31 in the ICU, and 15 deaths. The Calgary zone is seeing the brunt of it all. More than half of these cases are here.
Sometimes they can get some bad pneumonias out of the influenza as well. And that's where we get concerned because they have need for oxygen.
The flu is also starting to spread in Calgary schools. The Calgary Catholic School District confirmed 8 of its 122 schools have absentee rates of more than 10% due to illness. Experts point to low vaccination rates.
We're actually trending even below last year's record low levels.
The vaccination rate is below 20% in Calgary for kids 6 months to 11 years old. The lower northeast part of Calgary is the lowest at 6.2%, numbers that some say are trending in the wrong direction.
We lost over 200 Albertans last year. And to put that in perspective, before the pandemic, the average loss of life to flu was about 40 to 45 cases.
And some pharmacists are giving out less vaccines, calling on the province to provide stronger messaging.
I'm not sure what's going on, if it's vaccine fatigue still left over from COVID, or if it's a bit of miscommunication or misunderstanding.
But the province says its vaccine messaging is strong and that influenza and RSV cases are seeing a normal seasonal increase, pointing to other common sense measures that can make a difference too.
Keep your distance from them if they're obviously sick. If you're sick, stay at home. Good hand hygiene after you blow your nose particularly.
And while these tips can make an impact, others say an additional layer of protection could save more lives.
Otherwise, our health system will be taxed.
And Mark joins us live outside the Alberta Children's Hospital. So, Mark, how is Alberta Health responding to an increase in flu cases?
Well, Ian, Health Minister Adriana LaGrange says that hospitals like the Alberta Children's and other ones across the province are adapting what they call well-established surge plans to deal with the influx here. They're adding in some sites temporary beds as well as staffing, adjusting spaces as needed, and providing virtual care where kids don't have to be in hospital. They can recover from home. All of that sounds great to some people, but to others, it's still an issue. Frontline workers do tell us that taking a more proactive approach and encouraging vaccination in the first place could help prevent all of this. Ian.
Thank you, Mark.